And we have to get interactive. Mama, good morning to you.
Good morning, Roland Walker. How have you been walking?
Charlie, I did manage.
Yeah? Charlie, it's a Friday.
Yeah.
And you know, on Friday, you want to tell yourself, oh, like you losing up and take a break. But listen, everybody's staying at home. So I couldn't say that, really.
Yeah, definitely.
Are we sensing that this whole restriction is going to be
losing
exactly in the coming days?
It looks like, you know, the information minister yesterday, that press briefing said that, oh, it looks like they've done testing for majority of
they've gone beyond the target, actually.
The contacts that they had. And even for those that have been quarantined, you look at the number of tests that have been done and the percentage, which is still just a little above 1 of the percentage levels of those that have tested positive, and nationally also pegged at that same figure. It gives you that feeling that, yeah, they may loosen the grip on the lockdown, but look, we have to see, because there are still areas where, because of congestion and the lack of that space you need per population density, that you still need to keep a tab on. And we all know some of those congested communities where if people have cases or symptoms, they will have to spread it, just because either they don't have the proper information, they have nowhere else to sleep, or they still share a lot of things together, and that is the concern. So we'll see how it goes, but the committee, they have the best experts and they can best advise.
All right, let's dig straight into the newspapers. We'll bring you all these conversations, you know, in the course of our programming today. You know, why some people are beginning to think that we'll be easing this whole restrictions very soon. So, but I have the Daily Graphic newspaper. Before that, though, let me remind you, yesterday we're doing Ask the AM Doctor. Our doctor was on call, but along the line, we had to end abruptly because we had to join the information ministry for that all-important briefing. So we've got the AM Doctor back. We have all your WhatsApp messages that you sent, which we have forwarded to the AM Doctor. So we'll have him. That's him, Dr. Joseph Akama, answering all your questions. Yesterday we got we got some calls whilst I was in the office for Doc's WhatsApp number. He will be back this morning, and we will give you all those numbers again. So just stay put, don't miss any part of our show today. Let's do the Daily Graphic newspaper, shall we? Here's what's on the front page. Lockdown makes impact. So with a picture of the information minister, Kojo Oppong Nkrumah. Take COVID-19 directives seriously, according to doctors. Absorption of power tariff to cost 1 billion Ghana cedis, according to the energy minister. There's still some questions to be asked. Nasikane, is it there already? So we'll try and find answers to that particular question later on this morning. Tax reliefs for health workers implemented. Comes with a picture of Mr. Kwesi Kwanin Bosompim, acting controller and accountant general. In the center spread of the paper, Medical Women Association campaigns for use of nose mask. TUC will keep government in check on IMF loan utilization. The Tema General Hospital shuts pediatric units for disinfection after staff get exposed to COVID-19. And the story is out now, but the circumstances surrounding this, hopefully we'll be able to get into it. Not good at all. On the back page of the paper, somebody sent me a message on this yesterday, so I will read the Roland. Please read the headline for me.
Okay, so we have the headline, the back page, Mansamo P provides facility for General Hospital. And we told you that yesterday.
A viewer sent me a message. What did it? A viewer sent me a message on our regular WhatsApp number.
Mansamo P.
He said I should learn to speak Ga.
Oh.
So think that I did Ga when I was in JSS. Well, then that's when we used to call.
Okay, you attended JSS.
I actually wrote Ga.
You attended JSS. When you grow. No,
Masa.
Only that you look
when did SHS come?
Okay.
Masa. Don't make me look like I'm really, really old.
Oh, but you grow. If people know you go wrong.
One more story on the back page of the paper. FDA cautions public against substandard hand sanitizers. That call is still on. There are still very wicked people in the system who just want to give you the wrong mixtures and call sanitizers. So just look out for that. That's it for the daily graphic. Roland, what paper do you have?
Yeah, I have the Business and Financial Times. And so we have GCB providing daily meals for 500 doctors and frontline health workers. It's on the front page of the Business and Financial Times. But the main story occupying the front page is about electricity, and it's well captioned. Power relief to cause ECG 732 million. And in all, it's $1 billion. That's also announced by the Minister for Energy. Today we'll have an interaction with the communication consultant with the Ministry for Energy, or Ministry of Energy, Nana Damwa. And we're going to ask some of these critical questions as we break down the related issues, which categories of consumers are going to get what relief, who is going to be covered, etc. So that you know that what is going to affect your bottom line is going to be this, that. Already, the number of corporate bodies that are doing cost-cutting actions or measures. So we'll see how that goes when it comes to this conversation, because we're going to have a feel of all this throughout the rest of the year. Also on the front page of the Business and Financial Times, Accountant General implements tax reliefs to health workers. This is quite interesting because it says the Controller and Accountant General has implemented the 3-month tax relief granted to all health workers as directed by the President in his recent address to the nation on the coronavirus pandemic. And the President, in his address, April 5, 2020, announced a number of packages for health professionals in the front line or forefront of the fight. Of course, we know how that has been revised subsequently as well as to who is a frontline health worker, who is also in the middle or somewhere. All right, Essex Bank also doing it. We brought that story yesterday. But on the back page of the Business and Financial Times, it's about a leading research and public policy think tank calling on the African Union to defer the July 1st date for commencement of the Africa Continental Free Trade Area Agreement implementation. And it's a postponed July 1st trading date of AFTA. And we have a number of organizations who are also supporting the COVID-19 fight, and local cement manufacturers support COVID-19 fight with some 1.25 million US dollars, no, Ghana cedis, approximately 250,000 US dollars. Let's go to the Insight newspaper. Has on the front page, Alban Bagbin says Rollins supports Bahamas 2020 victory. We also do have Adam GH wants Ukuje to sacked as it calls on EC to disregard dangerous suggestions. GME mounts pressure for a nationwide lockdown. Family Health Hospital donates Ghana-made PPE to the Rich Hospital. And Mama, that's all I have. You do the rest of the newspapers.
Yes, let's do the Ghanaian Times newspaper. Now, front page of the Times, COVID-19 electricity relief. Government to spend $1 billion Ghana cedis to support 4.8 million customers in 3 months. Tema General Hospital shuts down pediatric ward over COVID-19. Accountant General begins deductions of President's salary. Others for COVID-19 fights. Ghana's COVID-19 cases hits 641, 83 recover and discharged. On the back page, GSS identifies, and that's the Ghana Statistical Service, identifies areas likely to be hard hit by COVID-19. And the Ghana Armed Forces has begun supplying free potable water to some targeted communities in Greater Accra as part of its effort to combat COVID-19. There was a video that I saw of the chief of defense staff, the army chief, and the IGP. A very beautiful video. Hopefully we can find it this morning and share with you. Talking about all of us staying at home, you staying at home as your home, stay at home to make the work a lot easier. But they also say, well, largely a lot of people are staying at home. There's still a small number of very stubborn people who refuse to stay at home and make their work very difficult. It's a joint video by the two gentlemen. Let's do the New Crusading Guide front page. COVID-19, survivor tells his story, says the disease is real and deadly. Yesterday we all saw in that press briefing a gentleman, Mr. Fred Dra is his name, share his story, the aspect of it, even as we spoke about stigma yesterday with Dr. Edwin on our show. He was talking about how people refuse to sell to his wife after he first shared his story. And I don't like, you had COVID and you've recovered, and so what? You know, like, and there's something that he said about the next person, that when he went for Roland, I'm not sure if you remember that particular bit where he went to the barber, and he was thinking, me, I know my status, how about you? You're running away from me, but I know my status, how about yourself? We shouldn't do that.
Well, there's one thing too that has been confirmed. It looks like cases coming from Korea is about the emergence of reinfection. So it will mean that people had tested positive and then treated, testing negative, and then they had been reinfected. Because, you know, the scientific community internationally were doing or undertaking studies to find out whether there was some sort of immunity post-recovery. And it looks like that is not the case. So we still need to be careful. So you've recovered. It doesn't psychologically means that you're what you still have to just keep to the protocols or the rules. And you know, it's one of the things that we need to keep educating people alongside the mainstream guidelines.
So our colleague Joseph Akable asked a very important question at the press briefing yesterday in terms of what they're doing for Mr. Dra in particular, for somebody who's recovered. What are the protocols? And the answer was, well, doctors still follow up, still keep in touch with him. So he's supposed to be reporting to the doctors who are in touch with him. Okay, let's do the rest of the stories on the front page. 2,000 youth to be trained. Rich Hospital receives first made in Ghana PPEs from Family Health. Your handwork is crucial. Vice President to staff of COVID-19 call center. He visited the call center, and I saw him seated by one of the...
I'm told that he received the call from a member of the
Hello,
public.
311, how may I help you? Back page of the New Crusading Guide newspaper, though. Ghana Used Clothing Dealers Association. Ghana Used Clothing Dealers Association donates 300,000 Ghana cedis to Coronavirus National Trust Fund. Galamsey claims across the river in Achim Hemai residents cry, even as we're all concentrating on COVID-19, all the other things that we battle with, all the issues, including Galamsey, still happening, except that the main focus is not on Galamsey. So people are still taking advantage of the situation and doing all the wrong things. We'll come back and they'll all be in our faces, you know, sadly. That's it for the papers. Roland, anything you want to review further? Oh, I wanted to share the Tema General Hospital matter. And so let me go to page 13. And it's in the Ghanaian Times. It says the Tema General Hospital has shut down its pediatric medical ward as part of measures to deal with a case of COVID-19 involving 2 senior staff of the ward. The affected staff have been isolated and are receiving treatment, while close to 50 staff of the departments believed to have been exposed are in self-quarantine for 14 days. Additionally, critically ill patients in the ward have been moved to another place in the hospital to continue receiving treatments, while others have been treated and discharged. Roland, even as we celebrate our frontline health workers, this is something that we have to talk about, because the background story to this is that the particular doctor at the center, even when it had been discovered that she had tested positive for COVID, they didn't communicate to the staff. You see the numbers, 50 persons now having to isolate themselves for 14 days, you know. And
there are concerns also from some staff of the hospital that apparently all these affected staff and their top-line medical doctors had treated people, patients, So, and pediatrician generally will look at pregnant women and
well,
children,
children, yes.
Children specifically, infants,
not pregnant
and all
women,
that.
children.
Yeah, infants, and they'll be brought to the hospital by their parents or guardians, etc.
So questions still remain. Even as we have 50 medical staff on isolation, have we traced the people that
I'm sure.
Because that number is not out there.
Yeah, because if a medical staff is infected, then it means even their families who are not members of the Ghana Health Service,
so you see,
will be affected.
Transparency.
And they are not even in the story in the first place. Yeah.
So the protocol, even as we call for people to bring PPEs, we talk about the challenges that you have. You must also maintain the protocols, learn the protocols, and stick by it. You can't be infected even as a medical practitioner. We see it happen all around. Let's spend the rest of the time we have doing myjoyonline.com. Hopefully we can do the BBC before we run off, Roland.
Yeah, definitely. So myjoyonline.com is there. It has a story, Ghana clearing about 12,000 backlog of COVID-19 test samples, but other stories dominating the page. AMA provides canopies for displaced old Fadamas quarters. You can even have an attached video when you click the story. Kwesi Parker-Wilson had been following this over the last 2-3 days. Who tested positive for coronavirus on the run? Well, the man who tested positive for coronavirus on the run in the Upper West region. Allied health professionals suspend planned withdrawal from COVID-19 contact tracing teams. Potential coronavirus vaccines being tested for safety. Professor Alex Dodu, who now heads the Ghana Standards Authority. We have by June the internet trend trading death for laughs in a pandemic, and 15 members of a family quarantined after contact with COVID-19 patients. Okay, and other stories related to COVID-19 out there. It's about the survivor, Fredra, who also appeared at that press interaction or update on Thursday. All there. Omavi.
Yes, let's do the BBC before we run off. Oh, our time is up. Okay, this is the BBC. Trump unveils plan to reopen states in phases. Now, that's very important because as COVID-19 continues to spread across the U.S., Trump has given governors guidance on reopening state economies in the coming months. The guidance for opening up America again, that's how it's called, opening up America again, outline 3 phases in which states can gradually ease their lockdowns. The U.S. has 654,301 confirmed cases and 32,186 deaths due to the virus. Is there any evidence for coronavirus lab release ideas? You can check details of that. Royal say lockdown is stressful on mental health. Absolutely. A lot more stories there, including this one. Champions League final set for August. But there's a decision to be made on the Premier League. Benedict will give us details of all that when he joins. But Roland, here we go with a video that I saw yesterday. I thought it was really cool. Here we go, let's share.
There comes a time when we heed a certain call.
First of all, let me thank all Ghanaians, for particularly those in the areas where movement has been partially restricted, for complying with the President's directives to stay at home. We note that a greater majority of the people are obeying the directives. Unfortunately, however, there are a minority who have been so far recalcitrant, and they are not staying at home as expected. We appeal to all such people to stay at home. If you don't have anything to do outside, please do not come out. Stay at home. We expect everybody to cooperate with the security officers enforcing those directives. Please do not fight them. If you get to your checkpoint and they ask you,
and do not fight them. Oh, I know you want to hear more, so we'll bring you more because there's the Army Chief also speaking and talking about this matter. That's the IGP, by the way. Roland, we have to take a breather and bring sports.
Definitely. So we're taking a break. When we come back, Benedict also will be here with sports.